The recent outbreak began in Wuhan, a city in the Hubei province of China. Reports of the first COVID-19 cases started in December 2019. Coronaviruses are common in certain species of animals such as cattle and camels. Although the transmission of coronaviruses from animals to humans is rare, this new strain likely came from bats, though one study suggests pangolins may be the origin. However, it remains unclear exactly how the virus first spread to the humans. Some reports trace the earliest cases back to a seafood and animal market in Wuhan. It may have been from here that SARS-CoV-2 started to spread to humans. We know that cats, dogs, and a few other types of animals can be infected with SARS-CoV-2, the virus that causes COVID-19, but we don't yet know all of the animals that can get infected. There have been reports of animals being infected with the virus worldwide. A small number of pets, cats, and dogs have been reported to be infected with the virus in several countries, including the United States. Most of these pets came back sick after contact with people with COVID-19. Several lions and tigers at New York City tested positive for SARS-CoV-2 after showing signs of respiratory illness. Public health officials believe these large cats became sick after being exposed to a zoo employee who was infected with SARS-CoV-2. All of these large cats have fully recovered. The virus that causes COVID-19 spreads mainly from person to person through respiratory droplets from coughing, sneezing, and talking. The CDC recommends that all people wear cloth face masks in public places where it is difficult to maintain a 6-foot or 2-meter distance from others. This will help slow the spread of the virus from asymptomatic people and people who do not know that they have contracted it. People should wear cloth face masks while continuing to practice physical distancing. Coronaviruses are a large family of viruses. Some coronaviruses cause cold-like illnesses in people, while others cause illnesses in certain types of animals such as cattle, camels, and bats. Some coronaviruses such as canine and feline coronaviruses infect only animals and do not infect humans. Recent studies show that people who are infected but do not have symptoms likely also play a role in the spread of COVID-19. At this time, there is no evidence that animals play a significant role in spreading the virus that causes COVID-19 based on the limited information available to date. The risk of animals spreading COVID-19 to people is considered to be low. More studies are needed to understand if and how different animals could be affected by COVID-19. SARS-CoV-2 has been reported in mink, which is closely related to ferrets, on multiple farms in Netherlands, Denmark, Spain, and the United States. SARS-CoV-2 infection in farmed mink has been characterized by respiratory disease and an increased mortality rate. Because some workers on these farms had symptoms of COVID-19, it is likely that infected farm workers were the source of the mink infections. Currently, there is no evidence that animals play a significant role in the spread of SARS-CoV-2 to people. However, reports from infected mink farms in the Netherlands suggest that in these environments, there is the possibility for spread of SARS-CoV-2 from mink to humans. Additionally, some farm cats and dogs and mink farms in Europe also tested positive for SARS-CoV-2, suggesting they had been exposed to the virus. It is critical that surgical masks and N95 respirators are reserved for healthcare workers. Risk of animals spreading the virus that causes COVID-19 to people. Some coronaviruses that infect animals can be spread to humans and then spread between people, but this is rare. This is what happened with the virus that caused the current outbreak of COVID-19, with the virus likely originating in bats. The first reported infections were linked to a live animal market, but the virus is now spreading from person to person. How does the virus spread? SARS-CoV-2 spreads from person to person through close communities. When people with COVID-19 breathe out or cough, they expel tiny droplets that contain the virus. These droplets can enter the mouth or nose of someone without the virus, causing an infection to occur. The most common way this illness spreads is through close contact with someone who has the infection. Close contact is within around 6 feet. The disease is most contagious when a person's symptoms are at their peak. However, it is possible for someone without symptoms to spread the virus. A new study suggests that 10% of infections are from people exhibiting no symptoms. Droplets containing the virus can also land on nearby surfaces or objects. Other people can pick up the virus by touching these surfaces or objects. Infection is likely if the person then touched their nose, their eyes, or their mouth. It is important to note that COVID-19 is new and research is still ongoing. There may also be other ways that the new coronavirus can spread. COVID-19 appeared in Wuhan, a city in China, in December 2019. Although health officials are still tracing the exact source of this new coronavirus, early hypotheses thought it may be linked to a seafood market in Wuhan, China. Some people who visited the market developed viral pneumonia caused by the new coronavirus. A study that came out on January 25, 2020, notes that the individual with the first reported case became ill on December 1, 2019, and had no link to the seafood market. Investigations are ongoing as to how this virus originated and spread. Coronavirus disease, or COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, and chronic respiratory disease and cancer are most likely to develop serious illness. The best way to prevent and slow down the transmission is to be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets or saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. The World Health Organization, or WHO, will continue to provide updated information as soon as clinical findings become available.